The story of GLP-1 medications just keeps getting bigger. First, they changed how we treat diabetes, then they transformed weight loss. Then came evidence suggesting benefits for heart disease, kidney disease, sleep apnea, and even addiction. Now, researchers are asking a question that would have seemed unbelievable just a few years ago. Could GLP-1 medications help protect against cancer? At this year's American Society of Clinical Oncology, or ASCO, meeting in Chicago, researchers presented more than 40 studies examining the relationship between GLP-1 medications and cancer, and the results were surprisingly consistent. Across multiple studies, people taking medications like Ozempic, Wegovy, Mounjaro, and Zepbound appeared to have lower rates of certain cancers, slower cancer progression, better survival, and even improved responses to some cancer treatments. But before anyone starts calling these drugs cancer prevention medications, there are some very important limitations that you need to know. Let's break down what the research actually found. One reason scientists became interested in this question is because obesity is already known to increase the risk of several types of cancer. Researchers have long understood that excess body fat isn't just stored energy. Fat tissue actually produces hormones and inflammatory chemicals that can influence how cells grow, divide, and repair themselves. Chronic inflammation is considered one of the major biological pathways involved in cancer development. Since GLP-1 medications reduce body weight and also appear to reduce inflammation throughout the body, scientists begin to wonder whether these drugs might influence cancer risk as well. What's particularly interesting is that some of the newest findings suggest the benefits may not be explained by weight loss alone. Researchers are increasingly investigating whether GLP-1 medications may have direct effects on inflammation, metabolism, immune function, and possibly even tumor biology itself. One of the most talked about studies at ASCO came from researchers at the University of Pennsylvania. They analyzed health records from more than 110,000 women between the ages of 45 and 80 who were overweight and undergoing breast imaging. After accounting for factors like age, obesity, diabetes status, race, and breast density, researchers found that women taking GLP-1 medications were approximately 30% less likely to develop breast cancer than women who were not taking the medications. In some analyses, the reduction was even greater at around 35%. Dr. Elizabeth McDonald, the lead investigator, emphasized that the study cannot prove GLP-1 medications prevented breast cancer. However, she says the findings add to a growing body of evidence suggesting these medications deserve serious investigation as potential cancer prevention tools. Researchers are now working toward launching clinical trials to test this question directly. The findings were not limited to breast cancer. Researchers presented studies showing potential benefits across a wide range of cancers. Some studies found lower rates of pancreatic cancer, prostate cancer, blood cancers, and several other malignancies among GLP-1 users. One particularly striking study looked at patients with chronic pancreatitis, a condition that significantly increases the risk of pancreatic cancer. Patients taking GLP-1 medications were found to be more than 50% less likely to develop pancreatic cancer than similar patients who weren't taking the drugs. Another study found GLP-1 use was associated with a 63% lower risk of acute myeloid leukemia, a serious blood cancer. Now, it's important to remember that these are associations, not proof, but researchers are paying attention because the same pattern keeps appearing across multiple studies, and multiple cancer types. Some of the most intriguing research looked at patients who already had cancer. Researchers from the Cleveland Clinic analyzed data from more than 12,000 patients with lung, breast, colorectal, and liver cancers. Patients that were taking GLP-1 medications were between 38 and 50% less likely to progress to metastatic disease compared with similar patients that were taking other diabetes medications. Metastatic disease is when cancer spreads to distant parts of the body, and preventing that progression is one of the biggest goals in cancer treatment. Researchers believe the anti-inflammatory and immune modulating effects of GLP-1 medications may be creating an environment that makes it harder for cancer cells to thrive and spread. Again, this does not prove cause and effect, but the findings were significant enough that researchers published the work in the Journal of Clinical Oncology. Another fascinating question is whether GLP-1 medications might actually help existing cancer treatments work better. Researchers studying patients with metastatic colorectal cancer found that those taking GLP-1 medications alongside immunotherapy had a lower mortality rate compared to those patients that were not taking GLP-1 drugs. A separate study looked at more than 25,000 patients with advanced non-small cell lung cancer receiving targeted therapies. 5-year survival was approximately 63% among GLP-1 users compared with 40% among non-users. Scientists believe GLP-1 medications may influence inflammation and immune system activity in ways that enhance the body's ability to respond to cancer treatments. At this point, it is still a theory, but it's one that researchers are taking increasingly seriously. Now let's talk about the biggest limitation. Nearly all of these studies were observational. That means that researchers looked at existing medical records and identified patterns. Observational studies can identify associations. They cannot prove causation. People prescribed GLP-1 medications may differ from non-users in important ways that researchers can't fully account for. They may have different health habits, different access to health care, different medical conditions, or other factors influencing outcomes. Scientists often point to metformin as a cautionary example. For years, observational studies suggested metformin dramatically reduced cancer risk. But when researchers conducted randomized clinical trials, the gold standard of medical research, many of those benefits failed to hold up. That's why experts are emphasizing that these findings are exciting, but they are not definitive. The next step is randomized controlled trials specifically designed to answer whether GLP-1 medications truly reduce cancer risk and if they improve cancer outcomes. What makes this research so remarkable is the bigger picture. GLP-1 medications were originally developed to lower blood sugar, yet researchers are now studying their effects on obesity, heart disease, kidney disease, sleep apnea, addiction, dementia, and cancer. The emerging theory is that many diseases that we once thought were separate may actually share common biological pathways involving inflammation, metabolism, and immune function. And if that's true, GLP-1 medications may be influencing far more than weight and blood sugar. For now, no one should start taking GLP-1 medications solely to prevent cancer. The evidence simply is not there yet. But after seeing more than 40 studies presented at one of the world's largest cancer conferences, it's clear that this is no longer a fringe idea. It's become one of the most important questions that researchers are now trying to answer. If future clinical trials confirm what these early studies are suggesting, the impact could be enormous. And as always, I will continue following the research and keeping you all updated here as new information becomes available. If you found this update helpful, be sure to give this video a thumbs up, subscribe for more evidence-based GLP-1 news and research updates, and let me know in the comments, do you think GLP-1 medications will eventually become part of cancer prevention or cancer treatment strategies? Thanks so much for watching today, and I'll see you in the next video.